I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. Welcome to Urban Health Weekly, where we talk about medical news and health topics that matter to you. I'm Tamara Thomas, and I'm here with Lou. How are you?
I'm doing great. It's great to be back.
Yeah, so we're actually officially back in the studio, and it's really good to be back. Later on, we'll have an interview with a woman who suffers from desmoid tumors who wants to raise awareness. But first, let me bring you up to speed. As some of you know, I had a prophylactic double mastectomy and reconstructive surgery last summer. And it was a long surgery, but my doctors were awesome. And I was up and around in a much shorter time than I thought. I miss my boobs, but I'm fine otherwise. Speaking of BRCA, though, moving on, I recently spoke with Dr. Andrew Hertler, who's an oncologist, board certified oncologist, and CMO of Evolent, about the new pancreatic cancer screening guidelines for those of us with BRCA1 and 2 gene mutations. So that's kind of exciting. And speaking of cancer, I saw this story. I just wanted to touch on it. Nicole Eggert. Did you ever watch Baywatch?
Briefly, I was one of the few people. Actually, I would watch Baywatch when I was out of the United States because it was one of the few shows in English that they would show whenever I traveled to the continent. I was in Germany or Amsterdam and stuff like that. And they wouldn't have any English TV, but then they had Baywatch and it was subtitled. So
okay. All right. So you may or may not be familiar with one of the stars. Everybody knows Pam Anderson, but Nicole Eggert was the other blonde on the show. Mm-hmm. And she just revealed her breast cancer diagnosis. Listen to this. Nicole Eggert has come forward to reveal that she's battling breast cancer. The actress, known for her work on TV series like Who's the Boss. It's funny. I said Charles in Charge, but it wasn't Charles in Charge. It's Who's the Boss. And Baywatch in the 80s and 90s told People in magazine in a new interview that she was diagnosed with stage 2 cribriform carcinoma cancer in early December. She's now waiting for her oncologist to schedule her treatments. As a single mother of 2, Eggert said she's struggling with the logistics of her treatment. My fear is that my everyday hustle, everything that I do to keep everything going, is going to come to a screeching halt when I'm not feeling well, or I'm sick, or I'm in the hospital, or whatever is going on, she explained. It's just so overwhelming. I'm just doing everything I can not to spiral. At night when I lay down, I panic because I'm like, well, who's going to cover all the bills? Who's going to do all of this? Eggert's friend Mindy Molinari started a GoFundMe campaign to raise money for her medical bills. I absolutely 100% want to start a nonprofit for other single parents such as myself who don't have any family, don't have anybody to turn to, Eggert said. They take on all this by themselves because they love their kids so much. But when something happens to them, then what?
Now, wouldn't she be well funded? I mean, I kind of want to stop you here. You would think a TV star with a show like that wouldn't need the GoFundMe, which we'll talk a little bit about later in the show about medical bankruptcy. But I guess what happened to the money from Baywatch? But
well, why do you assume that she made a lot of money on Baywatch?
Well, it's a syndicated show. I mean, actors do get residuals. She was a big enough character that she would get residuals. So,
well, I don't know much about Hollywood, but I do know that recently Taraji P. Henson, and just work with me here. I'll tell you how this ties in. She talked about the fact that she doesn't get paid a lot for the roles that she's done in a lot of these Hollywood productions. That she's working alongside people who are making millions of dollars, and she's getting like maybe $100,000. So I'm saying all that to say that you have like maybe 1 or 2 people making the lion's share of the money. Maybe that was Pam Anderson, maybe that was David Hasselhoff, but the other people are just so glad to be part of the production. All that budget is eaten up for the major stars, and then everyone else gets I don't want to say pittance because $100,000 is not pittance, but relative to $1 million an episode,
Hmm.
10,000 is not a lot of money. And then you've got to pay the agency, and then you've got to pay taxes on that
Right.
money.
Yeah.
There's really not a lot left. And then
She's
you
out in
buy.
California. I would
She
figure.
hasn't worked, to my knowledge, in quite some time. I don't
Hmm.
know what her contracts are cover in terms of residuals. So she may not really have that much money.
I got it. I got it. I got it. It was
Then
just
you've
like
got to
an
raise
aside.
children. Well, well, that's why I brought up the Taraji P Henson thing, just to point
Yeah.
out that there is a disparity. You
Yeah.
have the top stars who are making the lion's share of the money because they put butts in seats. I'm
Hmm.
saying that the clean way. But then you have the other people who, are not making that much money.
Hmm.
So it's entirely possible and feasible that someone like Nicole Eggert. I mean, you didn't even know who she was when I said when I
Right.
brought up.
It was like,
Yeah,
who's
but
that?
but if I said Pam Anderson, you know who that is right away.
Oh,
If I say
immediately. Yeah.
David Hasselhoff, you know who that is right away.
Right.
If I say David Charvet, who was also on the show, do you know who that is?
No.
No idea. Exactly.
Yeah.
So my point is you have some people who take up the majority of the budget, and then the rest of them get whatever's left.
Get it.
And
Yeah.
that's
Okay.
that's just how the business is, unfortunately, for a lot
Hmm.
of people. I know we talk about this topic a lot, but I think it's important that we don't lose sight of the lives of not just the patients, but the people that depend on these patients as well.
Hmm.
And I don't think we give enough thought. We think about the treatment and we think about all this groundbreaking, this and that, but we don't think about the logistics of people's lives. And so I just wanted to bring this back around because, as I said, I had my mastectomy over the summer, and I had the help of my stepmom. She came, she stayed at my home, she took care of me and my household while I recovered. She fed me,
Hmm.
fed my child, helped clean me up, kept the house clean, kept notes as I emptied my drains. And
Hmm.
I was very fortunate to have that help. I can't say the same for a lot of people. How many
Hmm.
people are lucky enough to have that kind of support? Not many.
Not many.
The
And those that
people who
do
have that
sometimes have
kind
to
of
pay
support
it.
are the people who end up surviving these things.
Yeah, I mean, if you're gonna hire a health aide, I guess it's gonna cost a couple of some coin. Um,
Even asking a friend to do it, the friend might not be able to do it because they're working. They
right.
can't afford to take time off of their schedule to take care of you, even if they're willing to do it. The economics just aren't there for a lot
Yeah.
of people.
Yeah. Yeah.
So I just want people to think about that as they go through, especially medical professionals, because I think medical professionals, they have this idea in their head of like, well, this is the plan and this is how it's got to happen. But I don't think they think beyond the medicine. I think they need to think about the person beyond the medicine a lot of time. And I think that needs to be part of what's baked into medical care.
Yeah. Well, if the care bankrupted her, which she has some means, I'm not going to say no means, but let's assume she has some means. Just imagine what it does to the regular person or the
Well, I don't think she's even started treatment yet. That she's still she at the time this was written, she was still waiting to see the oncologist. She hadn't even seen the oncologist yet, which means she hasn't started
no.
treatment yet. So she's thinking about this currently without having spent a dime for treatment yet.
Hmm.
And she
Wow.
probably has, SAG-AFTRA or whatever that insurance is that
Hmm.
the actors have. But I don't know that that's going to cover everything.
Hmm.
Insurance, cancer treatment is ridiculously expensive. I mean, I don't even want to think about how expensive it is. That it
Hmm.
goes beyond insurance. It bankrupts people. So, yeah, is she thinking about this? Of course, because I'm sure she's heard other people. I'm sure she's, heard other people's stories, and she's seen probably firsthand, maybe secondhand, what happens when you have a cancer diagnosis and you've got to stare down the barrel of like, okay, I've got to get some sort of treatment.
Hmm.
I read this crazy story one time, and I thought it was crazy. But for some people, like, this is their reality. This woman, she got her cancer diagnosis. She immediately went to the funeral home and bought herself a plot, because it was
Huh.
cheaper to buy herself a plot than it was to get treatment.
Yeah. Honestly, I think it's bad luck to buy a plot because I keep getting, now that I'm getting a little older, I keep getting all these solicitations in the mail and emails, and it's like I delete them right away. It's like, or tear them up or shred them. It's like, how dare you? But
Yeah, but I just want you to think about that's some people's realities. She's
Mhm.
like, I don't have the money to do this. I can't do it. So
Right.
I may as well just prepare to die, which is very sad, but also crazy. Not crazy like, oh, you're insane, but crazy like to think about.
Hmm.
Do we even want to talk about this? Yoga may improve rheumatoid arthritis symptoms. I mean, yes, let's
Quickly,
go there.
let's do it. Let's
Yeah,
let's get something a little bit more,
little lighthearted, okay?
little bit more upbeat here.
Not that rheumatoid arthritis is easy to deal with, but relative to cancer, I think. Yoga may improve rheumatoid arthritis symptoms, study shows. A new study showed the positive impact of yoga on rheumatoid arthritis, or RA for short. Specifically, it helped maintain cell homeostasis, which means cell stability, or optimal cell function. Gentle yoga is recommended for people with RA, but other styles could be modified with props under the guidance of a qualified yoga therapist or instructor. Despite the promising results, the study was small in size and short in duration. More research is needed to determine the benefits of yoga for RA symptoms. The study is compelling because it dives into the molecular mechanisms by which yoga could help alleviate the symptoms of RA, said Dr. Manisha Banote, integrative medicine lifestyle physician. I apologize if I botched that name. Cancer survivors have had great recovery practice in yoga. I've practiced yoga for years, and I can honestly say that it's a contributing factor to my ability to heal so quickly. I mean, I was up and around, faster than I thought I would have been. I'm not sure what's exactly about yoga, but I ended up returning to yoga when I was able, and I needed to restore my range of motion to my upper body. And it worked fine. According to American Osteopathic Association, the benefits of practicing yoga include increased flexibility, increased muscle strength and tone, improve respiration, energy, and vitality, maintaining a balanced metabolism, weight reduction, cardio and circulatory health, improved athletic performance, and protection from injury. I know some people think that yoga is boring, but there are all kinds of yoga practices for all temperaments and fitness levels. So I would encourage people to give it a try. Scientists find about 250,000 invisible nanoplastic particles in a liter of bottled water. Wow. The average liter of bottled water has nearly 250,000 invisible pieces of ever so tiny nanoplastics detected and categorized for the first time by a microscope using dual lasers. The World Health Organization, or WHO, says the level of microplastics in drinking water is not yet dangerous for humans, only calling for more research into potential future risk. But nanoplastics cross the blood-brain barrier. They interact with a particular protein that is naturally found in the brain, creating changes linked to Parkinson's disease and some types of dementia. A Duke-led study appeared last year in Science Advances, and they were quoted as saying Parkinson's disease has been called the fastest growing neurological disorder in the world. Fastest growing neurological disorder in the world, said principal investigator Andrew West, PhD professor in the Department of Pharmacology and Cancer Biology at Duke University School of Medicine. Numerous lines of data suggest environmental factors might play a prominent role in Parkinson's disease, but such factors have, for the most part, not been identified. Now, I'm linking these two together on my own. Okay, this wasn't all part of one article. This was, one was about the nanoplastics and the other one is about Parkinson's disease. And I'll let you guys figure it out. Anyway, improperly disposed plastics have been shown to break into very small pieces and accumulate in water and food supplies, and were found in the blood of most adults in a recent study. microplastic, and nanoplastic contaminants are also being closely evaluated for their potential impact in cancer and autoimmune diseases.
Jesus.
Yeah.
Well, right now, while there was a little bit of a pause there, I was trying to Google really quick how much of the world is water. And, I guess I'm not going to get to the answer of that in time to answer it, but I know that at least 60 to 70% of the world is water, is made of
Right, but
water.
potable water that you
Okay,
can drink.
water then you go into fresh water, which is what you find in lakes and rivers, and it's
But we're talking
condensed.
about drinkable water.
Well, once you go to there, once we go to the potable water, it's garbage right now, and that's a worldwide problem, not just a U.S. problem. Then trying to take that water that's not clean and putting it in all this plastic, because I see all the plastic and all the recycling and all of that, and I just wonder how much effort is being put into making sure that this plastic is clean and what goes on the inside of these bottles. We look at the outside, but what goes on the inside of these bottles, and it's just like frightening, because what happens to this plastic when it gets in your brain?
Well, I wonder though, because I'm guilty of drinking distilled bottled water, and I wonder if distilled bottled water has the same threat level. Let's see. Distilled bottled water nanoplastics.
Well, I did come that the requirements of the recommendations is that people drink maybe 88 ounces or anywhere between 88 to 104 ounces of water per day.
So the collected distilled water is typically free from microplastics, but I'm sure that changes once you put it in the bottle, even if the bottle is BPA free. Good heavens. Anyway, I've cut back from drinking bottled water, period, because it's just too scary. I have my filtered water that I drink mostly at home from glass or metal, and that's it. That's it for me.
I did find the statistics. 71% of the earth is covered by water.
Okay.
But 97% of that water is salt water and cannot be drank. 3% of the earth's water is fresh. Now, out of that 3%, that has to cover all of humanity, farm animals, all sorts of things, a lot of the crop irrigation. So you can start seeing how that water supply is strained.
Well, listen to this. The bottled water industry has pushed back against recent findings from Columbia University that its product contains hundreds of thousands of potentially dangerous nanoplastics. In a statement to The Hill, an industry trade association urged people to keep calm and keep drinking bottled water while scientists develop a more thorough understanding of these plastics and their impact on the human body. Media reports about these particles in drinking water do nothing more than unnecessarily scare consumers, the International Bottled Water Association said. They just don't want to step up and use different materials. They're like, we already use BPA free. What else do you want? I don't know. All I know for me is I've moved away from bottled water. I mean, I only drink distilled bottled water, but still, it's in a plastic bottle. And so
heavily filtered is the way I'm going also.
Yeah, just filtered water if you could swing it. They have filters now that you can put on your water bottle. And so if you drink bottled water, it has a filter on it, like a carbon filter. And well, it's better than nothing. I mean, not everybody can afford a flask or, necessarily have that at their disposal. So it's just something to think about. You can't go wrong with carbon. Yeah.
All right. Hopefully this will be a little more cheerful.
Well, I don't know about cheerful. COVID or allergies. Top symptoms are identical, doctors say. The most common symptoms of COVID-19 have become so mild that it's getting harder to tell the illness from allergies or the common cold, according to personal accounts from doctors. Although COVID hospitalizations continue their months-long increase, several doctors said that a sore throat followed by congestion are now the new hallmark symptoms. In the past, COVID symptoms included telltale signs like a dry cough or loss of sense of taste or smell. Though that was the original that
The
first knocked
original
everybody out.
COVID.
It isn't the same typical symptoms that we were seeing before. It's a lot of congestion, sometimes sneezing, usually a mild sore throat. These recent symptom reports are in line with findings from last winter that showed a sore throat had become the most common symptom among Omicron subvariants of the virus. Well, this virus, no, it's not the EG5 anymore. They've moved on to something else. I'm trying to remember what it is because they're moving through the Greek alphabet, what the next one is. But I have to tell you, I see very few people wearing masks. And I don't wear a mask. But I'm vaccinated up the hilt. And I made sure that my little one is vaccinated also. But I think I've also had every imaginable nasty strain. So I've probably built up a bit of, I think the general population has built up. We're probably at herd immunity at this point. That's not to say that people aren't still getting hospitalized for COVID. But I think, remember, we talked about this before where we speculated that it may just become kind of like the common cold. And it's happening.
Yeah.
That's sort of what's happening. And we're reaching herd immunity.
Yeah. Well,
by exposure.
I've been vaccinated at least 5 times. I think it's 6, but I remember specifically 5. And I took the New York City subway the other day. And one of the things that struck me is in a crowded car, there were only 2 people wearing masks. Now, the last time I took a subway, which was a few years ago, because I don't take the subway all that often, I would say 60 to 70 to 80% of that car was all masked up and everybody was looking at each other suspiciously. I mean, we still look at each other suspiciously for other reasons, but we were looking at each other suspiciously because, like, if anybody dared cough or sniffle, carrier. I didn't really have that anxiety anymore. I didn't have that feeling. I didn't have a feeling that it was going to get me. I remember the first time I had COVID, I was out for the count for about 2 or 3 days. And then I had it the second time, and it was, if I didn't test positive, because some people in my household had tested positive, I wouldn't have known I had it. I mean, I would have just gone about my day on a regular thing. Maybe had a little bit of a sniffle or a mild sore throat when I woke up, but that was it. And is the disease weakening, or do I have more antibodies? All of the above? Is the newness
definitely
wearing
a combination of the vaccine and antibodies, because there's only so many variants and subvariants that a virus can create. Cold, if you remember the flu was killing people in the 1920s, and now it's like you stay home and you drink some chicken soup and, and then you're back in a few days.
I can't remember as a kid the first time I ever went to a fast food restaurant. I know this is a crazy analogy, but that thing tasted like the best thing I ever ate. To me, this was like a Michelin 5-star restaurant. I guess it's with a kid's palate, and it's the first time you taste it. I guess after 10,000 of them in my lifetime, going there now, it's just like something to fill me up if I even eat a fast food meal. And do you lose a taste for it? Is the excitement gone? And I think, is the excitement gone from COVID and having COVID? Is that fear gone? I mean, how much of it was fear factor?
You're right. That was a really bad analogy. That was
really
bad analogy. But I get what you were trying to say.
Yeah.
Okay. I see what you're saying. That it's so. What you're saying basically is that, is it that overexposure? Yeah, of course it's overexposure. We've been exposed to it this is since. Well, really, 2019, 2020 is when we shut everything down. But we first started seeing this on our shores in 2020.
Right.
And so we're 4 years out. Let's see, 20, 21, 22, 23. We're 5 years out in this thing. I mean, I would think that between the vaccinated and immune systems, for those of us who are still here, that we've survived it, and it's getting to a point where our immune system is like, can't fool me anymore.
Yep.
So,
Well, now the flu's taken over, I think, as a
and
bit more,
RSV.
and RSV
Yeah.
as a bit more deadly.
Mm-hmm.
However, you still have that triumvirate floating around,
Let
so
me
it's still
tell
kind of
you, I
dangerous
took
out there.
my daughter broke her arms. Was it Thanksgiving? Yeah, she broke both her arms, and we were in the emergency room, and we were there forever because there were so many babies in the pediatric wing. I'm talking about little babies with RSV. It was so sad. Those doctors were like running back and forth. That's the new thing now, this RSV that's just like really affecting little children. I wouldn't say it's taking them out necessarily, but the pediatric emergency wing was filled. In fact, it was so filled we had to take her over to the adults section to do the procedure to reset her arms and stuff like that. Yeah, she's okay. Thanks for asking. Anyway, on to this week's topic, the cost of medical debt. I know we covered this before, but I think it's important to keep this conversation going because we're always talking about canceling student loans and canceling rent, but I don't see anything being said or done to stem, medical and dental debt. The following, what I'm going to read is from a KFF survey report. KFF Polling Group is an independent health policy pollster, and this was investigative reporting that they did in conjunction with NPR. You can find out more online, but listen to this and we can talk about it, or we can let people sit with it. Let's see where this goes. Unexpected bills can be a major contributor to healthcare debt. Most adults with healthcare debt say the bills that led to their debt were from a one-time or short-term medical expense, which are often unexpected. Indeed, about half of adults are vulnerable to falling into debt, saying they would be unable to pay a $500 unexpected medical bill without borrowing money. Though a third of those with current debt expect to pay it off within a year, or about a quarter expect to pay it off within 1 to 2 years, nearly 1 in 5 adults with healthcare debt think they will never be able to pay it off. In their efforts to service or pay off their debt, adults with healthcare debt report making a number of sacrifices and enduring substantial financial consequences. Most report cutting back on household spending, and more than 4 in 10 say they or a household member have used up all or most of their savings due to their healthcare debt. Many also report more serious consequences like skipping payment on other bills, delaying college or buying a home, or changing their housing situation as a result of their debt. In addition, about half of adults with healthcare debt say they have made what they feel to be a difficult sacrifice in order to pay down their debt. These sacrifices have left some individuals feeling as if they could not provide a good life for their families, or with a general sense that they will never be able to extricate themselves from debt. Other reported consequences of debt, such as being contacted by debt collectors and having their credit scores negatively affected, can lead to additional financial problems, such as difficulty buying vehicles needed for work or buying or renting a home. Healthcare debt can also affect the ability of individuals to access needed medical or dental care. 1 in 7 adults with healthcare debt say they have been denied care by a provider due to unpaid bills. In addition, adults with healthcare debt are more than twice as likely as those without debt to say they or someone they live with have postponed or skipped getting needed health care because of the cost. Those with lower incomes and people of color are more likely than their counterparts to report experiences like being contacted by collection agencies due to healthcare debt, being denied subsequent care, and making difficult sacrifices like changing their housing situation to pay down their debt. Isn't that sad?
It really is. And I'll share a little bit of a personal experience. I'm about to have cataract surgery in my eye, which is, yeah, as far as surgeries go, it's not a very, very big deal, but it's still surgery. And the doctor, in giving me the options, gave me some of the least desirable options first because I didn't have to pay any extra.
What were the undesirable options?
Well, the type of lens that you got, and they what they do on cataract surgery is once you get rid of they get rid of the unhealthy lens, they put an artificial lens in. So you can get a brand X lens that doesn't do a lot for you, or different type of lenses, and eye mapping and stuff like that. The bottom line is that it's not, even if you go the premium route.
Mm-hmm.
I'm not going to say it's not expensive, because maybe that's a little offensive, but it comes out to like $1,500,
That's
$2,000.
rich.
It could be rich, or some people say, "Wow, but
So that's the difference you have to pay between what your insurance covers and the rest of the bill.
yeah, but the way it was presented to me, it wasn't presented. I didn't get all the options. I got the options that were free first. And I said, but wait a minute, there's some other options that I read about. And the doctor said, oh, yeah, but you have to pay for those. And if I didn't ask for them, I wouldn't have been given the options that I had to pay for. And me to have all the options that I had as a patient. And I didn't wind up getting the most expensive eyeball,
Mm-hmm.
but maybe I got the second
Not
most
an
expensive.
eyeball, but go ahead.
It's a lamp. I'm trying to make it bigger than it is.
Clearly.
Yeah, they got the monocular one. They got they got the Steve Austin one, where it makes a little noise there and everything.
It clicks and whirs when it's
yeah, exactly. When it's going around my eye, I'm all goofing here, especially for you old timers that watch that show. Yeah. But I got you have to pay for it, but it isn't what I would call the premium. I think it's $700 or $1,000 or something like that. But I wasn't given the options, and then in my mind, and the reason I'm even using the story is in my mind is, if you have cancer, shouldn't you be given all the options and told that, okay, this is going to cost you more, but it's going to do this, and financial counseling at the time of your decisions. I think
they have this form now that they have you fill out when you see an oncologist, and they ask you, if you got a cancer diagnosis, would you be able to afford the care? And you have to answer, it's like, no, I wouldn't be able to afford the care. Yes, I'd be able to afford some of the care.
But why are you answering that before?
Well, because I guess it's going to determine how they're going to approach counseling you if you have a diagnosis. I know.
So what do I do? This deadbeat, they go, this deadbeat, forget about them.
Look, if somebody says, don't call them deadbeats, but if somebody is indigent and they get a cancer diagnosis, you can't talk to them about, say, immunotherapy and these expensive things. It's out of their reach. Why would you even set somebody up for failure like that? And then why would you want somebody to know? Well, I mean, I see what you're saying. They should be given the option. But if you know that financially it's out of the patient's reach, why would you even dangle that carrot in their face?
I think you have to throw everything out there and let the patient find out. I mean, there's all sorts of things. We were
like GoFundMe.
Like people get GoFundMe's when they're sick. I had a friend with glioblastoma, the brain thing.
Glioblastoma.
Yeah, yeah, and he raised quite a bit on a GoFundMe to go.
But didn't he die?
He died anyway, but they used up the money. He lived.
That's a shame.
Year.
He lived an extra year.
But it's all relative in terms of that. But I do feel that a person should be told all their options.
Let me tell you, I have a friend who had to move her family out of the U.S. because of medical debt. Her dentist popped her jaw, and dental insurance didn't want to pay for the repairs because they claimed it was medical. And then medical insurance didn't want to pay because they said it was dental. And so in between, she's having the surgery to have her jaw reset, and she had to pay for this out of her pocket, and it broke her. She had to sell her house, and she and her family ended up having to move to a country, not a state, not a city, a country with a lower cost of living, so that they could to continue living the lifestyle they were living, but on a smaller budget. But she had a house at least to sell and do that. And can you imagine the same story with a low-income patient? I remember talking to a woman years ago who was in a waiting room, and this was before COVID, and she just started talking to me out of the blue about her daughter's cancer treatment. And she said they had to sell their house, liquidate all their assets, and both she and her husband had to like come out of retirement to pay for her care. But she said, well, at least my daughter's alive. And that blew me away because I was like, wow. I mean, I'm glad your daughter's alive, but you guys are broke now. You have like no retirement. And that's I think that's highly unreasonable to ask people to go to that amount of toxic, financial toxicity to live. It's really not right. May McCormo, who's the CEO of the Tiger Lily Foundation, she had a similar story where she went through her entire retirement account and she had to move her and her daughter in with her mother. And you just hear too many stories like this. And I just wonder what the government is going to do about this. Although I am optimistic because Mayor, New York City Mayor Eric Adams, he is going to dismiss, I think, $500,000 in medical debt.
No, I think it's more. I think it's 13 million. Well, it's a 13.
Did he raise it?
Per person.
Is it per person? $500,000 per person?
It's a 13 million or whatever dollar pilot program. The problem with the program, I do think it's a good step in the right direction. However, the problem with the program is you have to be broke. You have to have been made broke in order to have the debt dismissed. So after you're now destitute, for whatever's left over, then you can apply to get rid of it.
So you can't have any kind of financial solvency,
right?
In order to qualify,
right?
So you can't get a leg up. You have to be
right.
You have to be
homeless. The debt had to have wiped you out, your savings out. You have to prove it, and once you prove that, whatever's left over then goes into a fund where they dismiss it and it doesn't follow you around. But first, it has to wipe you out.
I'm worried that this is going to enable and embolden the medical community to just charge people with impunity here because they figure, well, if they become indigent, the city's going to help them pay for it anyway. But on the flip side of that, maybe in that case, they will offer them the immunosuppressive therapy.
My feeling is I'm not as worried about doctors because doctors
it's not the doctors that are charging, it's the hospitals.
Well, that's
the
what
doctors
I was
are just providing the services.
The doctors have to face the patients, and they really, I feel that there's an empathy there. Not as much as I would like, but there is some empathy. I think the total lack of empathy is with the insurance companies, that they just have their little circular rules and they try to get out of all this debt. And they're not allowing the doctors to make the best patient care decisions. Patient care decisions are based on insurance capability.
If the insurance even pays.
And
like if they hear a person's Medicaid, forget about it. Then they're not really
and that
offering them
leads
anything.
to disparities. And that's why we have all of these
because they assume that, well, this person's not going to pay for it anyway, so why bother? The insurance is not going to pay for it. And it's funny, like my primary care doctor said that to me. We were talking about, I forgot what we were talking about. And he said to me, a lot of times, the decisions we make comes down to if we think the insurance is going to pay for it. And if we don't think the insurance is going to pay, we don't say anything. We just don't recommend it. And that is really, really sad.
Right.
Anyway, that's all we have for today. Let's listen to my interview about desmoid tumors. And we'll see you next time. This is Urban Health Today, and I'm speaking with Branee. And as a nurse, mother, and a desmoid patient advocate, she's here to raise awareness of desmoid tumors. Thanks for speaking with me today, Branee.
Yes, I'm happy to be here. Thank you, Tamara.
Glad to have you. So let's get started. First of all, what is a desmoid tumor?
So a desmoid tumor is abnormal growth of connective tissue. So it could be like healing tissue, and that pretty much can be sporadic, which means random occurrence, or can be hereditary. They can be locally aggressive. Since of much like scar tissue, mine was most likely caused from my C-section that I had with my deliveries.
Can you tell us your story? You said it was from a C-section, but what happened? How did you realize something was wrong?
Yeah, so I was, recovering postpartum and I was just applying some stretch mark oil and on my abdomen, I felt a firm area, like some swelling. So at first I thought could have been a hernia. So I sent a picture to my OB and I asked her, hey, do you think this is a concern? And she was like, oh, it could be a hernia, but we'll know when you come in for your postpartum appointment or you come in for your visit. So shortly after that, I started running into issues with other things. I had like gallbladder problems. So I was admitted to the hospital and they did imaging. At that time, they did an ultrasound and they did see a mass. And when they seen the mass, they're like, well, we need to get more detailed imaging. And so I ended up getting the CT. And then the CT revealed they thought it was hypertrophied muscles, which means pretty much just enlarged muscles. So it's actually misdiagnosed. Someone else came across my images right before I got discharged. So I guess another radiologist contacted my doctor that I was seeing that day. And they were like, hey, I think she has this rare tumor called the desmoid. Do you mind setting her up for a biopsy? And then shortly after that, my twin sister called me and she was like, are you sure that is not a desmoid tumor? I've been doing my research. And I'm like, well, you need to stay off Google. I don't think, I'll see what the doctor said. And so she was like, no, I think this might be it. Please mention it to them. And by the way, she's not in the medical field. She's an amazing teacher, though. So I did mention that to them. And shortly after that, 2 weeks later, I had a biopsy done and it was positive for the desmoid tumor and so that was like 2 months postpartum.
So just to recap, your doctor wasn't sure what it was at first, but then another provider saw the images and immediately recognized it as a desmoid tumor.
Yes, that's correct. With these being rare, not a lot of providers or radiologists may be familiar with desmoid tumors or even know how to care or treat for them. So, that wasn't the first thing that came to their mind when they came across my images. Because for me, I'm a nurse too. So like I'm sitting there and I'm looking at the images and she tells me, oh, it's nothing to worry about. It's simply just hypertrophy muscles. And I'm looking and, I'm getting concerned. I'm like, this is a tumor. This is a mass. So of course I would have, in reality, wish it could have just been that, but it was not that. So, I'm glad that someone came across my images and caught that before I was discharged from the hospital, or I would have just been misdiagnosed for a long time.
Thank goodness for that. Thank goodness. And then your sister also sort of recognized it from, people say that people shouldn't do searches online, but sometimes they are helpful.
Yes, they are. I'm even guilty of that as a nurse. So yes.
So what are common symptoms of a desmoid tumor?
So common symptoms, most of the time it's local pain. So where your tumor is located, it can feel like a stabbing, throbbing, or burning sensation. For me, with my experience, I mostly had like a stabbing sensation. So with intermittent, meaning it comes and goes. So it can feel like I'm being like poked with a safety pin, and it doesn't last long. So I choose not to take, any pain medications because by the time it would be working, the pain might have gone away for that occurrence of the pain. So you can have that. And then with mine being in my abdomen, it's on my abdominal wall where my muscles are. I have problems working out sometimes, so I can't really do ab workouts like I used to. Sometimes I have trouble holding both the kids. So that's been definitely a struggle for me, but I try to do my limitations and not do too much because I am an active person. I like working out. I just have to make sure I'm not putting too much pressure on my abdomen.
Is there a treatment available for desmoid tumors?
At this time, there's not a set treatment available for desmoid tumors. Again, since the they have trials ongoing, trying to get a set treatment. We have something getting approved hopefully soon by the FDA. But with them being unpredictable, and at this time, they just follow standard treatments that you would with cancer, like chemo, radiation, surgery. They try to use surgery as a last resort, just because it's high reoccurrence rates if you do have the tumor removed surgically. So I'm waiting on that. I'm just doing active surveillance and waiting.
So the desmoid tumor is not necessarily cancerous, but it's being treated by an oncologist. Is that?
Yes, that's correct.
Huh.
Yes. So for me, you have to research your options, and that's why I'm thankful for the Desmoid Tumor Research Foundation. They actually have a sarcoma specialist website where you can be linked to a doctor in your area. So a sarcoma specialist is someone that specializes in soft tumors, and the desmoids fall into that category. So you do need to see an oncologist since the treatments do fall along the same lines of that. Even though it's considered benign, it's locally aggressive. So we try to use that word instead, because it does take a toll on people physically, emotionally, mentally, and spiritually, and even financially with, when you have to go travel outside of your local area for treatment.
Why do you think clinicians have such a low awareness of desmoid tumors?
I think, again, just because they're so rare, it's often common for them to be misdiagnosed. And so that's why it's important to follow up and have support groups and knowing, where can I get treatment for this or get answers. If they're just not familiar with it, then, it's kind of hard to find someone that can specialize in that.
And how long after you started the imaging, how long was it between someone seeing it and your doctor agreeing, like, yeah, this is definitely a desmoid tumor?
I guess a couple of weeks after I had the biopsy done, and then they confirmed, that what the diagnosis was, I decided to see my local doctor here. And I did tell him I want to get a second opinion, someone that's a little bit more familiar with the tumors. So we did that as well. So you just have to also be an advocate for yourself too, and make sure that you're being proactive in your care and your treatment. And most doctors are understanding if they know you're doing a second opinion, just to make sure.
What do you want people to know about desmoid tumors as far as, how it's changed your life, what sorts of advocacy groups, what kind of support is available?
Yeah, so I really want people to understand that, it's okay to seek support and answers from those that are familiar with desmoid tumors. There are many support groups. I'm in at least 3 social media support groups. We have a direct support group, and then we also have like a direct messenger where we can connect directly with someone depending on the type of tumor, the location. We also have an annual conference, which is also coming up for Desmoid Tumor Awareness Month. So it's important to just be active, and just not for the patient, but also for the family members. So it's okay to, be patient with those dealing with desmoid tumors. It's a constant battle for us. We frequently deal with the fear or worry, about the unknown of our tumors, since they're unpredictable. So it's okay to, admit, if you have anxiety related to this, because I know for me, I had to end up, seeking therapy because it is kind of a traumatic experience to be diagnosed with something that you're not familiar with, and that's rare. And just having that support at home is very important too. And then again, use your resources to see a specialist if you can. And even that means traveling.
Has this changed your appearance any? Like, or is it something that grows on the outside of your skin, or is it protruding through? Or, if you don't mind me asking.
Yes, of course. So for mine, it does protrude. So I have like a bulging area in my abdomen. So for me, I feel like, oh, I never really recovered, from postpartum. I didn't get to work out because I had, so many limitations because of a treatment I did. And then also after that, it's still growing. And so I have to wear certain clothing. So I wear loose fitted clothing just to be safe, and not wear tight clothing. I've been told and asked, "Are you pregnant? When are you due? Congrats, you're having a baby." So it's been hard to hear that, and it does make me emotional because, of course, I'd rather be pregnant than have a tumor there. But this is what I'm dealt with, and that's what, I'm just going to continue my journey to healing, and hopefully one day I can get out of the loose fit clothing.
Branee, thank you so much for sharing your story today. And can you list a few of your the names of the support groups?
Yes, so it's on the DTRF page, so the Desmoid Tumor Research Foundation, and then also directly on Facebook. If you just go to Desmoid Tumor Research Foundation, the group is there as well.
Thank you so much. You're really weathering this with grace, and I thank you today for sharing your story. Really, really brave.
Thank you very much for having me.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.